Good morning, everyone. So the topic for today's presentation is functional appliances, which are also called as myofunctional appliances. And the treatment using myofunctional appliances is termed as functional jaw orthopedics. So as you can see in the first picture, a case of severe crowding which was treated orthodontically, and this was the end result. Now the patient was treated using fixed orthodontic appliance. What are the other treatment options that could have been given to this patient? It would be removable appliance, clear aligners, lingual appliance. Now, all these appliances come under the heading of orthodontic appliance. And these appliances can be given any time after the eruption of the permanent teeth. That is, which simply means that there is no age limit for giving an orthodontic appliance as long as the dentition as well as the periodontium is healthy. So what is orthodontics? Dontics means teeth and ortho just simply means straightening. So orthodontics means straightening of teeth. But there is something else also, that is orthopedics, which simply means that it is straightening of bone or the correction of bone. And this correction of bone during the growth period or during the young stage is termed as growth modification. So again, when you use the term growth, it simply means that orthopedic appliances should be given before the completion of the skeletal growth. So, and also the difference between orthodontic and orthopedic appliance is that orthodontic appliance can be given at any age after the eruption of permanent teeth, whereas an orthopedic appliance can be given only during active periods of growth. And that is why the specialty's full name is orthodontics and dentofacial orthopedics. So what are the growth modification appliances? They are being broadly classified into orthopedic appliances and myofunctional appliances. Now, orthopedic appliances include the headgear, face mask, and chin cup. And myofunctional appliances are what we are going to deal in detail today. And these myofunctional appliances are primarily indicated for a class 2 malocclusion with a mandibular deficiency. You might have known by now that a class 2 can occur because of maxillary excess or a mandibular deficiency or combinations. And myofunctional appliances are given when a class 2 is because of a mandibular deficiency. So, a malocclusion can happen because of any of these reasons. It can be either a skeletal problem, a dental problem, soft tissue problems, or combinations. Now, if the problem is skeletal and if the patient is coming to you at a very young age, what are the options that you can give them? It is growth modification. Growth modification means the appliance options will be either orthopedic appliance or functional appliances. But whereas the same patient is coming to you after the growth is completed, what will you give them? The options, it is either camouflage or orthognathic surgery. So myofunctional appliances, what did you understand now? They are indicated for class 2 problems because of a mandibular deficiency. And it is one of the growth modification appliances, that is, which means that it should be given before the completion of growth. Sometimes can be used in class 3s also, but unless otherwise specified, functional appliances are used for skeletal class 2 malocclusion in a growing patient. Please note the words for skeletal class 2 and in a growing patient. So, what does the term myofunctional appliance mean? Myo means muscle, functional is nothing but the jaw function, and appliances which can be classified as removable, fixed, or semi-fixed. So the definition of myofunctional appliance is that they are either removable or fixed appliances that alter the neuromuscular environment and generate or redirect forces for a normal dentofacial development. Now let us go into some of the history of the myofunctional appliances. It was Norman Kingsley in 1879 who first introduced the concept of functional appliances. Later, Pierre Robin in 1902 introduced an appliance called as the monoblock, and he first tried the appliance in a patient with a severe mandibular deficiency. As you can see in this photo, a child with a severe mandibular deficiency. And the appliance monoblock was given to this patient, or was given to one of the patients with the class 2 with the mandibular deficiency, to bring the mandible forward. By bringing the mandible forward, the airway obstruction can be relieved. That is, whenever a patient is having a severe mandibular deficiency, there is every chance for airway or respiratory obstruction. So to make the patient get relief from that, this monoblock appliance was given. And a patient with, I think you all must be aware of what is Pierre-Robin syndrome. It is actually a triad of cleft palate, glossoptosis, and mandibular deficiency of mandibular retrognathia. So such a patient, when it was treated by Pierre-Robin giving monoblock, the syndrome became named after him as the Pierre-Robin syndrome. So later, Viggo Anderson and Carl Hoppel, these two people in 1908 introduced the very popular activator appliance. So coming to the classification, of functional appliances, they are being broadly classified into removable, semi-fixed, and fixed. So under removable, you have the oval screen, anterior inclined biplane, or also called as the AIBP, activator, bionator, Frankel appliance, and the twin block appliance. And under semi-fixed, you have the Bars and the Denholz appliance, and under fixed, it is the Herbst, Jasper Jumper, and Forces. Of these, it is the removable functional appliances which are very important to you, whereas the others are not that important. Maybe you will be asked to name some of the fixed functional appliances during your viva or something, but all of these removable appliances are very important. They can be asked either as short note or even essay questions. Now, there are a lot of classifications given by different authors. According to Profit, the classification is tooth bone active, tooth bone passive, and tissue bone. According to Graeber, Group A, Group B, Group C. Group A are appliances which are completely teeth supported, B is teeth and tissue supported, and C is which are positioned completely in the vestibule. And Group 1, 2, and 3, 1 are appliances which transmit muscle forces directly to the teeth. Group 2 are those which reposition the mandible and transmit the forces to the teeth as well as the supporting structures. And Group 3 are those which repositions the mandible and operates in the vestibule. And apart from that, the other classification is myotonic and myodynamic appliances. Myotonic are those appliances which depend on the muscle mass for their action, and myodynamic are appliances which depend on the muscle action. So these are some of the pictures of the functional appliances. So the first is the picture of an oval screen. The second is an anterior inclined biplane. The third is an activator. The fourth appliance, that is the fourth picture, that is the pictures below, show the bionator appliance. The top two pictures show the Frankel appliance, otherwise called as the functional regulator. And the sixth one, that is the bottom two pictures, show the twin block appliance, because as you can see in the picture, it includes two blocks, an upper block and a lower block. Whereas all the pictures which you have seen before is a single block of appliance, whereas twin block is a two blocks of appliance. So it is comparatively easier for the patient to wear, and that is why this remains as one of the most popular appliances even today. The seventh one is a Bars appliance. The eighth one is a fixed function appliance, it is Herbst. Ninth one is a Jasper Jumper appliance, and 10th one is a Forces fixed functional appliance. Now we will be dealing in detail with each of these functional appliances in the upcoming classes. Now I have just shown you the pictures of it for you to have a rough idea. So coming to the indications. Again, as I told you earlier, Class 2 malocclusion because of a retrognathing mandible, and class 2s having a deep bite, muscular abnormalities, reduced face height, horizontal growth pattern, and upright lower incisors are the ideal indications. Now, why horizontal growth pattern is that at the end of functional appliance, this horizontal growth pattern might become an average or a more towards a vertical growth pattern because functional appliances tend to open the bite a little. Also, the lower incisors at the end of treatment might become more proclined. So it is better that if you start the case with the upright, it might become it might become little proclined at the end of treatment. But if you're starting the case with proclined lower incisors, then the incisors might become severely proclined at the end of treatment. And then the less important indications include the class 3 malocclusions, open bite, and bimaxillary proclination. So the indications are in the decreasing order of importance. The most important is the class 2. And the very important indication is that for treating any of the above indications, it is important that the patient has to be during the periods of growth. Now, contraindications include, again, when growth is completed, you cannot give a functional appliance, high angle case, proclined lower incisors, purely dental malocclusions, and individual tooth malpositions. Now, this high angle case and proclined lower incisors are some universal contraindications which you can write for any of the functional appliances. Again, purely dental malocclusions and individual tooth malpositions. When the malocclusion is completely dental, it is not necessary you need to go for a growth modification appliance like a myofunctional appliance. So coming to the advantages, it is going to correct the skeletal problem, correction of the soft tissue problems, oral hygiene maintenance will become better, less chair side time is required, and there is good patient acceptance. Correction of skeletal problem at a very younger age is going to prevent the need for surgery at a later date. That is, when the growth is over and the patient is having a skeletal problem, surgery will be the only option. So that can be avoided if you're going to treat the case with a functional appliance. Coming to the disadvantages, it cannot be used in adults, obviously, and need a second phase of fixed appliance treatment. That's because when you're giving a functional appliance, you are aiming to treat only the skeletal problem. So the dental problem that is there in the patient will be remaining even at the end of the functional appliance treatment. So for the dental problems to get corrected, you might require a second phase of fixed appliance treatment, which simply means that the treatment duration will be really prolonged. And as you have seen the pictures, all these functional appliances are very bulky and not easy for the patient to wear. And they require good patient cooperation because most of them are removable appliances, and hence only if the patient is going to wear the appliance 24/7, you're going to see results. And as I told already, the treatment time is lengthy and the timing of treatment is very, very critical because only when the patient is growing, you can give a growth modification appliance, which means that only during the pubertal growth spurt. So coming to the case selection criteria, it is important that the patient has to be growing, a class 2 patient with a retrognathing mandible, a horizontal growth pattern patient, the lower incisors need to be upright. All these 4 things you know already. Now the 5th thing, that is positive VTO. So what is the meaning of VTO, or what is the full form of VTO? It simply means that it is visualized treatment objective. So what is a visualized treatment objective? It is when a patient, now you can see here, it is a growing patient. Now she satisfies all the first 4 criteria. She is a growing patient, a class 2 with a retrognathing mandible, as you can see in the picture. She's a horizontal grower or a low angle case, and intraorally she also had upright lowered incisors. So how do you check the VTO now? Now the patient is in a normal, relaxed position. Now you will have to ask the patient to advance the mandible forward and then bite, as you can see in the second picture. And when the patient advances and bites, you have to see whether the profile of the patient is improving. Now, as you can see in this, the second picture, the patient looks better than in the first picture. It simply means that the VTO is positive. So when the profile improves, it means it is a positive VTO, and when the patient is advancing the mandible and if the profile is getting worsened, it means that as a VTO is negative. So only when there is a positive VTO, it is an indication that you can give a functional appliance. So now you are aware what are the skeletal problems, the treatment options that are available for the skeletal problems. That is, what will you do when the problem happens at a younger age, that is growth modification, in older age, which is either camouflage or surgical correction. Then what are functional appliances, the different classifications of functional appliances, the indications, contraindications, advantages, disadvantages, the case selection, and the diagnosis. So today we have completed till this. Now the various functional appliances will be dealt in detail in the subsequent classes. Thank you.